Hi, everyone. I'm going to be talking about HIV today. I'm going to talk briefly about it. We'll be talking about STDs and HIV next class. So to get started, what is HIV? HIV actually stands for Human Immunodeficiency Virus. And what that means is that HIV is a virus that attacks the cells in the body. So HIV is literally the virus that attacks the cells in the body that fight off infection. Now, it's important that you know that HIV, the virus, targets a specific cell in the body, and these are called T cells. And what T cells are, they're a type of white blood cell, and they play a critical role in helping the body fight off infections. So what happens is the HIV virus is going to invade the body and attack these cells so that the body can no longer fight off infections. Whenever the HIV virus attacks too many of these cells, what's going to happen is the immune system is no longer going to be able to fight off a lot of infections. So if you would get like a simple cold, it would seem like something much worse because your immune system isn't doing its job to fight off infections. So you definitely need to know that T cells are the main target for the HIV infection. They're basically a specific type of white blood cell that plays a role in our immune system. So then in class, we would take a look inside of an infected person's body, and we do a little skit where you could see what happens in the body. We're not going to do that obviously now, but what the skit pretty much shows is there's somebody there and they're like not feeling well, and then all of a sudden time goes by and then they start to feel worse, and then they realize that they have HIV, and then they end up dying because they didn't get treatment. So HIV is the virus, human immunodeficiency virus. And remember, the virus attacks the immune system. But whenever the virus attacks the immune system so much that it can no longer fight infections at all, that's when it turns into AIDS. So HIV and AIDS are very similar, but AIDS is the name of the disease that you get from having a weak immune system. So AIDS is called acquired immune deficiency syndrome, and that's the disease of the immune system. So that's what I'm talking about now. HIV is the virus that destroys it, and then AIDS is the disease that you get because of the HIV virus. So how can you get HIV? You get it when an infected person's body fluids gets into your blood. There are 4 fluids that are going to spread HIV. First one's blood, second one's semen, then we have vaginal fluid, and we have breast milk. So then I would ask you, could you get HIV by getting bit by a mosquito or insect? And you would guess. And the answer is actually no. A lot of people have this false belief because, they suck your blood and then they bite other people, but it's not possible. Can you get it from sitting on a toilet seat where someone with HIV previously sat? No, because maybe if there was blood on the seat, but it's very unlikely. Can you get it from having unprotected sex? Yes, because it is spread through fluids, semen and vaginal. Those fluids happen during sex. Can you get it from hugging someone? No. Can you get it from sharing syringes or needles? The answer is yes. If you're putting something in your body, you're going to get blood, and then you're going to give it to other people. Can you get it from being coughed on? No, because they're not giving you the 4 fluids. If you share eating utensils, no, unless for whatever reason there's blood, but that's not going to happen. If there's an HIV positive mother breastfeeding an infant, yes. So they will have the HIV virus no matter what, because it's a viral STD. So they're not allowed to breastfeed. And a lot of times they'll have to deliver their baby by C-section as well. So there are different ways that HIV is transmitted. We talked about the different ways you can get it. First one's blood, the most common way this will happen. Number 1 is if you're using drugs and sharing needles. And then another 2 instances where you could share needles is if you're getting a tattoo done and the tattoo parlor that you go to isn't very safe and they reuse needles and don't clean them well or whatever. And then same thing with the piercings. You can get it through unprotected sex, infected blood, semen, or vaginal fluid. It's going to pass through the break in your skin or a mucous membrane in this case. And then you can also get it from an infected mother either during birth or through breast milk. So if I list these symptoms, fever, headache, swollen lymph nodes, rash, sore joints and muscles, a sore throat, whatever, what typically would you think of if somebody was experiencing these symptoms? You would typically think that someone has a common cold or a flu or something like that. But what really is happening whenever they're infected with a virus is stage 1 of the HIV infection. And this is called the acute primary infection. And basically they have flu-like symptoms. It's what's happening. This is going to happen 1 to 4 weeks after getting HIV. And some people experience these symptoms, but some people experience none at all. Then it's going to go to stage 2. This is called the asymptomatic stage. So once you get through that acute primary infection and you have those initial symptoms, what's going to happen is you're going to start to feel better and you're not going to show any symptoms. HIV actually might not even cause more symptoms for around 10 to 15 years, and you would still be infected with the virus. However, even if you don't have symptoms, the virus is still active in your body. And if it's left undiagnosed and untreated, it will cause severe damage to the immune system, leading to AIDS. Like I said, it is destroying those infective fighting cells. So you have to get a handle on that. To help you kind of remember this stage, literally asymptomatic, which hopefully you know now since we've experienced COVID, you're familiar with. You have asymptomatic or whatever. That just means you're not showing any symptoms. And then stage 3 is that symptomatic stage, the actual HIV infection. And then at this stage, the immune system is severely damaged. The body's more likely to get infections or diseases it could originally fight off if not infected with HIV. And if not treated soon enough, you could actually die. So some symptoms at this stage, you're going to have some weight loss, chronic diarrhea, night sweats, fever, and a persistent cough. And then just to confirm, symptomatic means serving as a symptom or sign. This is a video of a woman that has AIDS. They filled her every day for 90 days once her infection progressed to AIDS. And then they kind of just show you how she's getting skinny. I have that linked on Canvas if you want to see it, but I'm not going to play it because it gets copyrighted. I want to talk about the white blood cell count. So when you're infected with HIV, kind of what's happening with your white blood cells. In a healthy individual, so someone like you and me, we have 600 to 1,200 T cells in our body per cubic millimeter of blood that fight off infections. If we are not healthy, we would have 200 or fewer. So our body would not be able to fight off infections because we don't have enough of those T cells, and that's their job in our body. So just be aware of that. There is a way to get diagnosed for HIV. Obviously, a blood test is going to be the best way to learn your status. You go to the doctor, they test your blood, and then they can run it to see if you have the virus. You can purchase an over-the-counter test. It's called OraQuick. It's $36. However, just like any other thing, like a pregnancy test, it's always best to confirm with a doctor just to be sure it's the truth. This kind of shows you how you take the oral test if you choose to do that. So it's a viral infection. You always have it. But how do you get a treatment for it? There is no cure. It's viral. There's no cure. There's no way that you can stop this disease from happening. However, there are medications that can help. What the medications are going to do, they're going to slow the infection from advancing to AIDS. So yes, you'll still have the HIV virus in your system, but you won't be super sick or be unable to fight off those infections because of the medications and science that we have today. There's also additional medication that can actually strengthen your immune system as well. We'll do this in class, I think, on Monday, Tuesday. What you're going to do right now for your assignment, just to confirm, here is where you should hopefully have been looking. It says, go to the link below and complete the assignment. It's an HIV template. All you're doing is you're finding someone who was infected with the HIV virus. They could be famous or somebody on the internet or whatever. you're going to look somebody up. You can literally Google someone who had HIV, and then you're just going to make a little short biography about them. So you'd put their name here. So whoever it is, the date they were born, the date they died. You're going to put a little biography about them. So this is what they do. Down here, you're going to write the transmission or cause. So this is how they got HIV. And then you're going to come up with 3 things they could have done to prevent the infection from happening. So what are 3 ways they could have stopped themselves from getting it in the first place? And then here in the middle, you're going to put a picture of whoever you choose to do the template over. If you have any questions about how to do this, I do have office hours today, 9 to 9:45, and then it's like 12:45 to 1:30 or something, or you can always email me. Thanks, guys.